Okay, so I think like before we get into the audience questions, I think I'd like to go ahead and ask you just like the big fish question of it all, like about how like smoking or vaping affects our lungs.
Absolutely. That's a very good question. Everybody who smokes knows that it's bad for them. Everybody who vapes knows it's bad for them. The problems with smoking and vaping are not just physical, they don't just affect your physical capabilities and your lungs, but they also affect you psychologically. So, just purely speaking physically, smoking affects the balance in your lungs to a certain degree. The way I like to explain it to my patients is when you smoke, you affect the balance which keeps your tissues, which are your lung tissues, safe. All our human body has enzymes which damage protein and enzymes which protect protein from getting damaged. Smoking causes imbalance and it increases the amount of activity in the enzymes which actually cause tissue damage. Because of that, you tend to suffer a particularly specific type of damage inside the lungs called emphysema. In emphysema, you lose your lung tissue, and your lung tissue also loses its nice, fluffy elasticity which lungs should have. Healthy lungs are like delicate balloons, and they're very, very flexible. They are very elastic. When you take a breath, your lung expands nicely, and when you let go, it relaxes very beautifully. And that is the normal lung physiology. Smoking makes that go away. Your lungs are not going to perform their actions very well. Because of that, patients who want to exercise, if they have emphysema, they do not have the capability of breathing out all their air. And because of that, it causes emphysema. Not just emphysema, but it can also cause a multiple number of interstitial lung diseases and also makes you prone to developing diseases like asthma. Everybody thinks asthma is something that you are born with, but epigenetic studies tell you that asthma can be acquired. Viral infections, environmental factors, sometimes even smoking can lead you to develop asthma as you get older in life. Moreover, when you compare the morphological and physical effects, the psychological effects are also a big deal because smoking affects your ability to stay grounded. You are addicted to a substance which you know is bad for you. And that makes a big change in the way you think, the way you process things, and your addictive nature as well. So patients who smoke are more prone to developing addictions. Is it because of them being prone to addictions that they smoke? We don't know the answer to that. I know that's a long-winded answer for your question. In simple terms, smoking damages your lungs and causes emphysema. It can also cause interstitial lung disease and also can cause you to have worsening of your asthma or develop asthma. Vaping is a whole different topic. When you're talking about vaping, it is not as simple as tobacco because we know what tobacco contains. Vape liquid is an artificially produced substance which the manufacturer can put whatever he wants in there. Your lungs are not designed to take in artificial substances. Your lungs only need healthy, clean air. They do not need anything else inside them. When you vape, you are putting whatever chemical, whatever solvents that manufacturer has used to dissolve the nicotine or marijuana, whatever is the desired substance in that vape, whatever you are inhaling for the purpose. But when you add all these other chemicals which are solvents, which are completely unregulated, you don't know what damage you're going to do to your lungs. There is a very well documented phenomenon called EVALI or vaping induced lung injury, in which patients come in with a bad pneumonia, acute onset, as in they develop symptoms within 3, 4, 5 days and they are deathly ill. And not everybody gets better. The mortality rate is actually quite high. And depending upon what study you look at, the mortality rate is anywhere from 10% to 40%. And a lot of patients end up on ECMO and they have a lot of life changing disability even after they recover. One of the chemicals that was implicated was vitamin E acetate, and that was used as a solvent to dissolve the marijuana and the flavoring agents to help the vape taste better. So, vaping lung injury is less predictable than smoking, but when you do end up with lung injury from vaping, it is a lot more acute, lot more severe, as in it happens a lot more suddenly, and the patients recover very poorly. So, I would strongly advise that vaping is extremely dangerous. Smoking is more predictable, but it is equally dangerous.